Hi, I'm Nicole with Health, Beauty, and More, and this is a segment on beauty, but it's also kind of medically related in some cases, and it's regarding a procedure called blepharoplasty, which is where when your eyelids start drooping, they get more and more hooded. And that's a normal thing by the age of 70. Most all people start having symptoms of blepharoplasty. And a lot of insurance companies will cover blepharoplasty if the requirements are met. It has to be documented by photo of the drooping eyelid. So it's excess skin on the upper eyelid. And also documented clinically by a doctor. And thirdly, supposed to be documented to show that the visual field test, that's for peripheral vision, would be better with this procedure. The insurance companies do not usually cover the lower eyelid blepharoplasty. So if there's excessive skin in the eyelid, then they have to go through this criteria. And Medicare has done thousands of them. So when it's impairing someone's vision, that's a clue. If it is hard to open your eyes, that's another clue. Then the insurance might possibly cover it for that reason there. Some people have to use tape on their eyelids just to keep them open. A lot of people that have this upper lid drooping can actually see their eyelashes. That's how low they are. So they need to be tested to confirm whether or not it's blocking their vision. And then they do this test by having you sit in this machine. It's like a box. And they cover one eye at a time. They show these little lights. They have you stare at a symbol, and you keep your eye on the center of that symbol while this little flashing or blinking light moves around, and you click this mechanism that reads out on a chart for the evaluator to see if you are able to spot the correct flashing light. Now, if it's way out in the periphery and you don't see it, then you don't click on that little clicker thing. So that's one way of checking it out. And I'll post a picture at the end of this video so you can see a little bit about what I'm talking about. It actually is controversial because not only is it a medical procedure, but it's also a cosmetic procedure. So it does have the appearance of making your eye look bigger when they do this procedure. And I've known people as young as 50 that had this done, but insurance didn't cover it, I don't think. But most of the time they will cover it if it meets these criteria and you have an ophthalmologist confirm that you meet those criteria. The field test is the main thing. So check it out if you think you're a candidate, and find out what the insurance would cover. They probably don't cover the whole cost of the procedure, but it may be medically necessary in some cases. It's Nicole, Health, Beauty, and More.